This was Gordon Brown's first major speech on health since becoming Prime Minister last year. He outlined his commitment to building on the reputation of the NHS and of improving all medical procedures and practices for the future. It would, he said, improve prevention rates and offer a more personal service too.
This July we celebrate the 60th anniversary of the NHS. Not only a great British institution, but a great, unique and very British expression of an ideal which has led the world. That healthcare is not a privilege to be purchased, but a moral right secured by all. And every family in Britain has benefited from that great ideal. Over the last 6 decades, the NHS has cared for tens of millions of people, saved many hundreds of thousands of lives. It has been at the forefront of innovation in healthcare too, pioneering advances in medical treatment such as triple therapy for tuberculosis, in surgery such as artificial hip replacement, in imaging with the development of MRI scanning, and with its unique offer of healthcare free to all at the point of need, it has liberated all of us from the fears of unaffordable treatment and untreated illness. But as we begin to celebrate the achievements of the NHS over the last 60 years, it is also right that as new technologies emerge, as expectations rise, and as healthcare needs change, we look ahead and continue to reform and renew the NHS for the future. We can build on its strengths and make it stronger. The NHS of the future will do more than just provide the best technologies to cure. It will also, as our population ages and long-term conditions become more prevalent, be an NHS that emphasises care too. The NHS of the future will do more than treat patients who are ill. It will be an NHS offering prevention as well. The NHS of the future will be more than a universal service. It will be a personal service for patients too. And it will not be the NHS of the passive patient. The NHS of the future will be one of patient power, patients engaged and taking control, greater control over their own health and their healthcare too. So if the NHS is to change like this, to meet the challenges of 21st century healthcare and to meet the challenge of living 21st century lives, we will have to embrace even deeper and wider reforms. For the fact is that the health service of the next decades will need to recognise and respond to the very different challenges from those that the NHS faced 60 years ago. Over the last half-century, technology has opened up vast new areas of diagnosis and treatment, and the potential, as everyone here knows, of further scientific advance is colossal. With cutting-edge technologies from genetics to stem cell therapy, life-saving drugs to prevent, alleviate or cure conditions like Alzheimer's, likely to be developed in the years ahead, what seem medical miracles today will be medically routine tomorrow. So if we are to prevent as much suffering and save as many lives as possible, it is clear that utilising these new technologies must continue to be at the heart of any progressive health policy. In too many countries around the world, many new technological breakthroughs become available only to a select few with the ability to pay. Even those systems which offer protection to disadvantaged groups very rarely offer them the same quality of care as the best off. But because we provide a universal service and not a minimum service, and by prioritising the adoption of medical advances across the NHS, we can make sure that the very best care is offered to all British people, and not just some, all British people based on the need they have, not the money they have. And whereas in many other countries this scientific revolution could become a profound social injustice, as those with a predisposition to specific conditions face exorbitant private insurance costs or even exclusion from cover altogether, in Britain healthcare will be guaranteed to everyone free of charge, regardless of medical conditions. Our British National Health Service is almost uniquely well placed to deliver this transformation in the relationship between patients and clinicians. One of the most trusted organisations as it is in British society. Doctors, nurses, staff, all recognised by everyone as a force for good in our country. And let me thank again everyone who is working so hard to make the National Health Service work to its best and make all the change happen. The renewal of the NHS will be our highest priority. Our goal is deeper and wider reforms building on the values, principles and the great idealism of the NHS to create, therefore, for the next decade, a National Health Service that is here for all of us, but personal to each of us, focused on prevention as well as care, and strong and confident enough to put real control into the hands of individuals and their clinicians. I believe that this is a worthy mission for an institution as great and as significant in our lives as the National Health Service. And it's a transformation that I believe possible and I want us all to be part of. Thank you very much.
The Prime Minister believes Britain is at the dawn of a new era of healthcare, one that is focused equally on prevention as much as cure, and one that puts care control into the hands of individuals and their clinicians.